In this knee osteoarthritis series, we've looked at imaging, activity, injections, and progression, and in this video, we're focusing on flare-ups, which are common but often misunderstood. Drop a comment down below to let us know about your experience if you've ever had a flare-up of knee pain.
Okay, so let's dive right in and unpack what's going on with these sudden flare-ups. We're going to start with what they feel like, then get into why hurt doesn't necessarily mean more harm, what's happening inside the knee, and finally, what can trigger these events.
So first things first, let's get on the same page. The term flare-up gets thrown around a lot, but what are we really talking about when someone with knee osteoarthritis has one? What does it actually mean?
Well, for a lot of people, the number one thing is just how sudden and totally unpredictable it feels. One day your knee might be feeling okay, pretty manageable, and then the next, bam! The pain, the stiffness, the swelling, it just spikes dramatically. This quote from a person in a research study just nails that feeling perfectly. They describe it as coming out of the blue, like a sudden attack. It's not this slow, gradual worsening. It feels like something that just blindsides you and messes up your whole day.
So even though everyone might describe it a little differently, there's a general consensus. A flare is a distinct, sudden worsening of symptoms. We're talking pain, swelling, stiffness, and it's bad enough that it really gets in the way of your normal life. But you know what the key word here is? The really important one? Temporary.
And that brings us to maybe the single most important question that people have during a flare-up. It's that immediate worry that pops into your head when the pain suddenly ramps up. And understanding this is, well, it's a huge relief for many.
And here it is, right? Did I do something? Have I caused more damage? Does this mean my arthritis is getting worse, faster? It's a totally normal thing to think, but the answer is actually incredibly reassuring.
The evidence we have points very strongly to this. The intensity of the pain you feel doesn't always line up with the physical state of your joint. Now, I know that can be a really tough idea to wrap your head around when you're in a lot of pain, but it's so important to understand.
In fact, study after study shows this really clear disconnect. I mean, look at this. You have a huge chunk of people, almost 40% in one study, who have knee pain, but their x-rays look completely normal. And then you have the opposite. About half of middle-aged women with clear signs of arthritis on their x-ray reported having no pain at all. It just goes to show that pain is a much more complex experience than what a simple picture of a joint can ever tell us.
Okay, so if it's not always new damage, then what is going on inside the joint that's causing this sudden spike in symptoms? Let's kind of peel back the layers and take a look at the biology here.
A really big factor is a process called synovitis. We used to think of osteoarthritis as just wear and tear, but we now know it has a big inflammatory side to it. And during a flare-up, that inflammation can temporarily just kick into a higher gear. This here gives us a good picture of what's happening. The lining of your joint, it's called the synovial membrane, it gets irritated, and its response is to create extra fluid and release these inflammatory chemicals. That's what causes the swelling you can see, the feeling of warmth, and of course, the increase in pain. It's a very real physical process, but again, the key is that it's a temporary one.
Now, this is where the story gets really interesting. It's not just what's happening in the joint, but how the joint is talking to your nervous system. This is a huge piece of the puzzle, and it explains why the pain can feel so out of proportion sometimes.
So this idea is called sensitization. And basically, in a state of chronic pain, your whole nervous system can get better and better at creating pain. It's kind of like a home alarm system that's become way too sensitive. It starts blaring at full volume for even the smallest little thing.
And this sensitization can happen on two levels. First, you have peripheral sensitization. That's the local alarm. The nerves right there in and around the knee get extra sensitive from all those inflammatory chemicals. But then it can also become central. That's the system-wide alert, where your brain and spinal cord actually learn to amplify pain signals, making your entire system way more reactive.
And this isn't some rare thing. Research suggests that up to a third of people with knee OA have a nervous system that's in this sensitized state. And that's such a crucial concept because it helps us understand why the pain during a flare can feel so intense, maybe even spread out a bit, even when there's no new injury to the joint itself.
So we've got a joint that can get temporarily inflamed, and we've got a nervous system that might be extra sensitive. Now let's talk about the final piece of the puzzle, the trigger. What actually sets the whole thing off?
The thing is, it's almost never just one single thing that causes a flare-up. It's usually more like a perfect storm, a combination of different factors all coming together at just the wrong moment, pushing that already sensitive system over the edge.
Now, what triggers a flare is super individual. It's different for everyone. But research shows us that they tend to fall into a few common buckets. You've got the activity-related stuff, right? Like doing something you're not used to, or an activity that just puts a lot of strain on the knee. But just as important are these psychosocial factors, things like a really bad night's sleep, or being under a lot of stress, or feeling down. And for some people, even the weather can be part of that mix.
This really puts it all together beautifully. You start at your baseline, which for some people is a system that's already a bit primed and sensitive. Then, a trigger happens, or maybe a couple of triggers. And the result? That temporary but very real spike in symptoms that we call a flare-up.
So, if there's one thing to take away from all of this, it's this. A flare-up is best understood as your body's amplified reaction. It's driven by that temporary inflammation and that sensitive nervous system. It is not necessarily a sign of new joint damage. And just thinking about it that way, well, that's an incredibly powerful and accurate first step.
This shift in perspective is huge. Moving from a place of fearing harm to a place of understanding sensitivity, it can honestly change the whole experience. So it leaves us with a really important question to reflect on. How does knowing that hurt isn't the same thing as harm change how you think about your own pain?